Sujan Ghosh, consultant speech swallows pathologist at Bhagirathi Neotia Women and Child Care Center, Newton Hospital. So today our topic of discussion is feeding and swallowing issues in newborns and pediatric populations. So first we want to discuss with you people that what is feeding problems or swallowing problems. In terms of in neonates, newborn babies, they have different issues like feeding, like a latching problem. Sometimes they have poor sucking skills. So why these things are happens? So in general cases, a baby comes out premature or preterm, like they have a poor sucking and feeding skills. They have difficulty in sucking maternal breast, or sometimes poor feeding skills. They have a problem of choking or sort of distress during feeding. So embryologically, any antenatal history or at the period of 33 weeks, maybe our embryo may acquire the skills of sucking and proper feeding physiologies. So if they comes out before, they might have a sucking or suck-swallow coordination, or a poor breath and sucking coordination. So they might have a sort of distress, choked or vomiting tendencies. So in that cases, these babies need to assist for swallowing and interventions with swallowing strategies to prevent their problems. As a parent, you people always remember about your baby's feeding developmental milestone. Most of the cases come to my clinic with the age of 1.5 years or 2 years. They were sometimes complaining about their baby's poor feeding tendencies. They didn't want to feed solids, or they have aversions of solid feeds, intaking solid feeds, or they didn't want to take solids. They have vomiting tendencies, hyperactive gags, and during swallowing. So why these things arises? We have to remember that swallowing is always related to the functioning of oromotor skills of your baby. So what is the meaning of oromotor skills? That is your baby development of tongue muscles, orbicularis lips muscles, and the coordination of feeding. It's developing by after you start intaking of liquids to semi-solid, like within 6 to 7 months. Once they start taking purees, soft paste diets, in that time they need to improve their feeding. Drastically changes from liquid or milk to purees or semi-solid. As per the guidelines, as per the ASHA guidelines or International Dysphagia Council, they suggest that if your baby is still 2 years of age and yet not take a proper solid feeds, they didn't want to chew or try to swallow the food instead of chewing or munching the food properly, they need to assist the swallowing and feeding skills. And here the most of the important thing is regarding swallowing stimulations. Feeding stimulation, oromotor muscles development is very important. So here we are trying to educate you people regarding the swallowing development, regarding the swallowing skills of your baby. And I prefer do not indulge your baby in much bottle feed after 2 years. Try to provide them proper structured food from soft to solid. Provide them proper brushing and oral hygiene is very important. The thing is, once your baby chew properly, swallow properly, it obviously develops their language also. The swallowing skills, sucking skills are directly proportionally help your baby's language development, brain development. So in that cases, we always advise you to introduce your baby proper feeding structures at proper age. And oral hygiene, oral functions are very important for that cases. So if they have any sort of abnormalities or problem, you can come to our clinic or in our hospital for consultancy, and we are always here for you.